We're very much standing on the shoulders of giants here. All the amazing work that's gone into siRNA chemistry, RNA delivery over the last couple of decades. But one of the perennial challenges of doing anything in neuroscience is delivery, and how do you manage to traverse that very robust and very well designed blood-brain barrier that tries to keep things out rather than let things in. But there have been some amazing breakthroughs in recent 12 to 18 months in particular with respect to what are referred to as shuttles. So basically co-opting the brain's sort of natural transport system for nutrients. So kind of how the brain feeds itself using things like iron or glucose. And if you can almost convince the blood-brain barrier that you are one of those nutrients, you're able to basically hitch a ride across that blood-brain barrier using these natural endogenous receptors that the brain uses to transport nutrients across. So basically what we do is we design siRNAs for targets that we think are particularly exciting for patient populations where we think we can make a big impact, and then we conjugate them to delivery vehicles or shuttles that help to pull that payload or that potentially very powerful siRNA-based medicine into the CNS. And if you can do that, and you do that efficiently, not only can you enable a more convenient delivery of the medicine, because it can be administered systemically, potentially even at home, rather than having to go into the hospital for an intrathecal or even surgery to deliver these things. So that's great, but also what we've seen with some of the early data that's coming out of folks like Roche with trontinemab and others is that actually your biodistribution in the brain looks very powerful, looks perhaps even more potent than intrathecal delivery, which could be a real game changer for patients. Because one of the big challenges with delivery intrathecally or delivery through a lumbar puncture into the spinal column is that you're kind of fighting against gravity. You're trying to get that drug into the kind of deep brain, but that's not always the most straightforward biological process. But if you can basically manipulate or use the brain's natural vascularization, so the way the brain is sort of a hypervascularized organ. I'm not 100% in this stat, but I think there's like 700 kilometers of capillaries in the brain. If you can use all that natural blood circulatory system and then basically hitch a ride across the brain's endogenous mechanism for feeding itself, for lack of a better term, then you can really do some impactful work because you get a really broad brain distribution. That's what we've seen with trontinemab now with antibody delivery, which looks amazing and hopefully will result in a really impactful medicine for patients. Can we do that with siRNA?
Yeah.